coronaviruses are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome (SARS), and Middle East respiratory syndrome (MERS). In 2019, a new coronavirus was identified, acute respiratory syndrome coronavirus 2 (SARS-CoV-2). The disease it causes is called coronavirus disease 2019 (COVID-19). Cases of COVID-19 have been reported in a growing number of countries, including the US public health groups such as the World Health Organization (WHO) and the US Centers for Disease Control and Prevention (CDC) are monitoring the situation and posting updates on their websites. These groups have also issued recommendations for preventing and treating the illness. Signs and symptoms of COVID-19 may appear 2 to 14 days after exposure and can include fever, cough, shortness of breath, or difficulty breathing. The severity of COVID-19 symptoms can range from very mild to severe. People who are older or have existing medical conditions such as heart disease may be at higher risk of serious illness. This is similar to what is seen with other respiratory illnesses such as influenza. Risk factors for COVID-19 appear to include recent travel from or residence in an area with ongoing spread of COVID-19 was determined by CDC or WHO. Close contact with someone who has COVID-19, such as when a family member or healthcare worker takes care of an infected person. Although there is no vaccine available to prevent infection with the new coronavirus, you can take steps to reduce your risk of infection. WHO and CDC recommend following the standard precautions for avoiding respiratory viruses. Step 1. Wash your hands often with soap and water or use an alcoholic based hand sanitizer. Step 2. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Step 3. Avoid touching your eyes, nose, and mouth if your hands are not clean. Step 4. Avoid close contact with anyone who is sick. Step 5. Avoid sharing dishes, glasses, bedding, and other household items if you are sick. Step 6. Clean and disinfect surface you are often touched. Step 7. Stay home from work, school, and public areas if you are sick. CDC doesn't recommend that healthy people wear a face mask to protect themselves from respiratory illnesses, including COVID-19. Only wear a mask if a healthcare provider tells you to do so. WHO also recommends that you avoid eating raw or uncooked meat or animal organs. Avoid contact with live animals and surface they may have touched if you are visiting live markets in areas that have recently had new coronavirus cases.